This is what you need to know for after every single procedure. We're going to go through each one. That way you can know what that maintenance looks like.
Welcome back to Your Face Unfiltered. I'm Dr. Keith Ladner, double board certified facial plastic surgeon, and we are back with Julian, who is the director of our non-surgical team. And today is, I think, a little bit unique, if I can say a little bit. It really is either unique or it's not, but that's neither here nor there. We're going to be going through for each procedure what Julian recommends after that procedure to optimize the results. All right,
I'm ready.
so let's get going. So, brow lift. What do patients need?
So brow lift is interesting because, sometimes you're going to have those incisions in the hairline. So you're going to have, a risk of having some hair loss in those areas. And, a lot of our patients' main concern is how am I going to get this hair to regrow? What's really nice is we actually have a hair serum that is an exosome-based serum. So it's going to help regenerate, reheal those hair cells. So I think having that is great because it gives them a lot of comfort in knowing that hair is going to be coming back and not gone forever. Yep. And then also neurotoxins is huge with the brow lift, especially with maintaining those results, keeping that brow up, making sure those expression lines are taken care of. I think that's the number one treatment, I would say, after a brow lift.
Perfect. Yeah. So actually a great phrase that I learned under my amazing fellowship director and mentor, Dr. Ferrier, was he would tell his patients, he would say, a brow lift is like going into the dentist and getting your teeth cleaned, and Botox is like brushing your teeth in between those treatments.
I love that.
So in other words, you need both. The brow lift is a reset, is a repositioning to a better contour or position on the forehead, open up the eyes. But that still doesn't mean that you're not going to make lines of animation when you raise your eyebrows. So the Botox is going to help maintain that resultant appearance. So that's perfect. Okay, CO2 laser. What are those treatments?
So CO2 laser is a really good one because that's really, you're going to want to focus on like medical grade skincare and keeping care of your skin. And what a lot of people don't understand is you really need to continue doing your CO2s afterwards. It's not a one-stop shop. You want to do maintenance. So what's really cool is we have different procedures here with our Helix laser. We're able to do like a light cool peel, which is like a light CO2. We're able to do like a medium or moderate to aggressive. So you don't have to go as aggressive on surgery day afterwards. But you want to continue with that skin's integrity and results by continuing those treatments. I think with medical grade skincare, you want to keep on with your anti-pigment. For example, you don't want any pigmentation resurfacing. You want to help with your skin's integrity, so bringing in some growth factors, bringing in your retinoids, and to help with that cellular turnover and keep that skin's integrity going, as well as those nice glowy results, I would say.
Perfect. Okay. Deep plane facelift, deep plane neck lift. What are your go-to treatments?
Deep plane facelift and neck lift, my go-to treatments would definitely be, you want to continue with your neurotoxins. I think that's across the board. Like I said, a lot of people with surgery, it helps from like a structural wise, but when it comes to like fine lines and animation and expressions, you really want to do your neurotoxins to help kind of smooth that over, I would say, and also keep those results going. And then as far as also medical grade skincare, you want to take care of those incisions that are in the hairline with using a growth factor. You want to help all of your incisions all over by introducing a retinoid or a growth factor as well.
Okay. Yep. And then how about for the incisions themselves in terms of optimizing the healing? Any other scar creams you'd recommend?
Yeah, definitely. We actually carry a Ladner scar cream, which is great. And it's silicone based. So that's going to be something that we recommend to every single one of our patients, especially our facelift patients. So that way they feel comfort in knowing that we are there to help making sure to optimize those results. Because I do feel like scarring, it could be a huge factor when it comes to people making decisions and something that they worry about. So we want to make sure that we give them all what we can, including that scar cream, the hyacinth spray, which is great, which is going to be antibacterial, antifungal, which I use every single day because I love it just as a toner. But really making sure that after a surgery, we're there to help them through that journey of healing, and we have all of the right products to do so.
Yeah, that's great. So obviously, to minimize scarring, that starts with me. And making sure that, I'm doing all the things necessary during surgery to optimize the appearance of the scars. And that's going to be not only the placement of the incisions, but also tension-free and a true plastic surgery closure of those incisions. But that doesn't mean that we're still not going to recommend doing the scar treatments afterwards. because if we can go even above and beyond what we're doing with surgery, obviously why not, right?
And outside of skincare, to go above and beyond, you have your certain treatments like using the CO2 laser to help with incisions and kind of those things showing post surgery. A microneedling is huge. You can microneedle over that scar as well to kind of help with its appearance. So not even just doing skincare, but also moving into those non-surgical treatments as well.
Yeah. Okay, great. If you like what you heard today, please be sure to like the video and subscribe to our channel.